Do you know the difference between high and low blood pressure? Let's delve into the mystery of blood pressure and unravel its importance in the human body. Blood pressure is the force that circulates blood through our bodies, supplying oxygen and nutrients to every cell. It's like the water pressure in your home's plumbing system. Too high and your pipes might burst. Too low and you won't get enough water from your taps. Just as you need the right water pressure to keep your home running smoothly, you need the right blood pressure to keep your body functioning optimally. This pressure, however, isn't constant. It fluctuates throughout the day, influenced by a myriad of factors such as age, lifestyle, and even hereditary aspects. Age, for instance, tends to increase blood pressure as the elasticity of our arteries decreases over time. Lifestyle choices such as diet and exercise also play a major role. A diet high in salt or a sedentary lifestyle can raise blood pressure, while regular exercise and a balanced diet can help keep it in check. And then there are the genetic factors. If high or low blood pressure runs in your family, you could be more susceptible to experiencing the same. The intriguing part is that blood pressure isn't universally good or bad. While high blood pressure or hypertension is often termed the silent killer due to its potential to cause serious health issues like heart disease and stroke, low blood pressure isn't always a boon either. Low blood pressure or hypertension might sound desirable, but it can lead to fainting or dizziness due to inadequate blood flow to the brain and other vital organs. It's a delicate balance, much like a tightrope walker maintaining equilibrium on a thin wire. Unraveling the mystery of blood pressure is like piecing together a complex puzzle. Every factor plays a part, and understanding how they interact is vital to managing your health. Understanding the difference between high and low blood pressure is key to maintaining a healthy body. So let's continue our journey into the fascinating world of blood pressure. High blood pressure, often called the silent killer, can lead to severe health complications. But what exactly is high blood pressure, and why is it such a cause for concern? Let's delve into it. Imagine a garden hose. When you turn on the tap, water flows through it easily, reaching the flowers at the other end. Now imagine if you turn the tap on full blast. The water rushes through the hose, putting tremendous pressure on its walls. That's what high blood pressure, or hypertension, is like. It's when the force of your blood against your artery walls is consistently too high. But what causes this overpressure in our body's pipeline? There are many potential culprits. It can be due to genetic reasons or lifestyle factors like a high-salt diet, lack of physical activity, or excessive alcohol consumption. Stress can also play a significant role. Now, the reason it's called the silent killer is that it often has no noticeable symptoms. You might not know you have high blood pressure until you experience complications, such as a heart attack or stroke. That's why it's so important to have your blood pressure checked regularly. High blood pressure can lead to a host of health issues if left unchecked. It can cause damage to your arteries, leading to conditions like heart disease, kidney disease, and stroke. It can also affect your vision, causing eye problems. It's a serious condition, but the good news is it's manageable. Understanding high blood pressure is the first step. Knowing what causes it, the potential health risks, and the importance of regular checkups can help you manage and prevent hypertension. It's about taking control of your health and not letting this silent killer sneak up on you. So remember, just like that garden hose, our bodies need just the right amount of pressure to function properly. Too much and things can go awry. Being aware of the risks of high blood pressure is the first step towards managing it. On the other hand, low blood pressure might seem desirable, but it's not always a good thing. You see, every system in our body requires a certain level of pressure to function optimally, and our circulatory system is no exception. Low blood pressure, or hypertension as it's technically known, is when the pressure in your arteries is abnormally low. Picture a garden hose. If there's too much pressure, the hose might burst. But if there's too little, the water can't reach the flowers you're trying to nourish. It's the same with our blood vessels. Blood needs to reach every nook and cranny of our body, supplying oxygen and nutrients. If the pressure is too low, our body might not receive what it needs to function properly. Now, what causes this low blood pressure? It can be due to a variety of factors. It could be dehydration or prolonged bed rest. Certain medications can also cause it, as can certain health conditions like heart problems, endocrine problems, or even pregnancy. The symptoms of low blood pressure are often subtle, but they're crucial to recognize. You might feel dizzy or lightheaded, especially when standing up. You may experience fainting, blurred vision, nausea, fatigue, or lack of concentration. It's like your body is running on low battery. The health implications of prolonged low blood pressure can be serious. It might lead to insufficient oxygen reaching your body's tissues, leading to a condition known as hypoxia. Over time, this can result in damage to your heart and brain. But don't be scared. Just like with high blood pressure, there are ways to manage low blood pressure. It could be as simple as making changes to your diet, drinking more fluids, or adjusting your medications under your doctor's guidance. In the end, it's all about balance. Too much pressure isn't good, but neither is too little. Low blood pressure, just like high blood pressure, requires careful attention and management, because when it comes to our health, every detail counts. So, how can you keep your blood pressure in check? Now that's a million-dollar question, isn't it? Our bodies are like intricate machines, and managing blood pressure is all about maintaining the right balance. Firstly, let's talk about lifestyle changes. It's no secret that our habits play a significant role in our health. From the moment you wake up to the time you hit the hay, each decision affects this balance. It's crucial to limit alcohol and caffeine intake, quit smoking, and reduce stress levels. Yes, easier said than done, but remember, every step towards a healthier lifestyle is a step towards balanced blood pressure. Next, diet. The food we consume fuels our bodies. A diet rich in fruits, vegetables, whole grains, and lean proteins can work wonders. Reducing sodium in processed foods is equally important. Ever heard of the DASH diet? It stands for Dietary Approaches to Stop Hypertension and is a proven method to lower blood pressure. Then comes exercise. Regular physical activity strengthens the heart, and a strong heart can pump more blood with less effort. This reduces the strain on your arteries, leading to lower blood pressure. Aim for at least 30 minutes of moderate intensity exercise most days of the week. And no, it doesn't always have to be a grueling gym session. A brisk walk in the park or a leisurely bike ride can do the trick. Medication can also play a vital role in managing blood pressure, especially when lifestyle changes aren't enough. But remember, medication should always be taken under the supervision of a healthcare professional. Lastly, never underestimate the importance of regular checkups and monitoring. Regular blood pressure readings can help you and your doctor understand your condition better and adjust your treatment plan accordingly. Managing blood pressure is a delicate balancing act, but with the right knowledge and habits, it's completely doable. So let's take charge of our health and make those small yet significant changes today. Let's strive for balance, for a healthier and happier life. Now that we've delved into the world of blood pressure, what are the key points to take away? Firstly, we've discovered that blood pressure isn't as straightforward as it seems. High blood pressure, also known as hypertension, is often labeled as the silent killer due to its lack of noticeable symptoms. It's caused by factors such as a high sodium diet, lack of physical activity, and stress. If left unchecked, hypertension can lead to serious health complications like heart disease and stroke. Conversely, low blood pressure or hypotension isn't always a sign of good health. It can be caused by dehydration, certain medications, or underlying health conditions. Symptoms can include dizziness, fainting, and fatigue. While not as dangerous as hypertension, hypotension can still be a sign of a serious health issue that needs medical attention. Understanding these differences is crucial. High blood pressure isn't simply the opposite of low blood pressure, and both conditions require different approaches for management and treatment. One key point we've reiterated throughout is the importance of regular checkups. Early detection can make a significant difference in managing both hypertension and hypotension. We also explored various ways to balance your blood pressure, emphasizing the role of lifestyle changes. Eating a balanced diet low in sodium and high in fruits and vegetables, maintaining a healthy weight, exercising regularly, managing stress, and limiting alcohol are all ways to keep your blood pressure in check. Moreover, we've learned that medication is sometimes necessary to manage blood pressure, and there's no shame in that. What matters most is taking the necessary steps to ensure your health and well-being. And let's not forget the power of knowledge. Being informed about your health empowers you to make the best decisions for your body. It's not about being perfect. It's about striving for better health each day. Remember, understanding your blood pressure is a vital step towards a healthier you. So, keep learning, stay proactive, and let's journey towards better health together.